Hey guys, welcome back to Neuronify. This is day 8 of our FMT series, and the topic is acute and chronic ethyl alcohol poisoning. This topic is very simple yet important, and as usual, we'll be solving MCQs at the last. So stay till the last, learn this topic, and revise this topic thoroughly. Without wasting a single minute, we'll start the topic. What are inebriants? Very new word. Inebriants is a formal classification under which there are substances that produce intoxication by depressing the CNS, leading to impairment of judgment, coordination, perception, and behavior. Ethyl alcohol is the prototype, and examples of inebriants are ethyl alcohol, methanol, which is methyl alcohol, and chloral hydrate. In simple words, we can understand that inebriance is nothing but a formal word given to alcohols. I mean, alcohols come under the category of inebriants. And what are inebriants? Those who depress the CNS and those who cause the impairment of judgment, coordination, perception, and behavior. So a very main topic of today's discussion would be ethyl alcohol. It is also called as ethanol C2H5OH, commonest inebriant producing intoxication. And what are alcohols? These are nothing but your hydroxy derivatives, OH derivatives of aliphatic hydrocarbons, ROH. In unqualified terms, we equalize alcohol to ethanol, but that is not correct. People usually, they think that ethanol equals alcohol. No. Alcohol is a main broad term, a very big term under which various types of ROH or hydroxy derivatives are found, like ethanol, methanol, based on the R group. But ethanol is type of alcohol, you can say. So commonly alcohol consists of different types of R groups in it. So calling alcohol as ethanol and calling ethanol as alcohol is technically not correct. Specific gravity, remember, 0.79, which means 1 ml of alcohol weighs 0.79 grams. Ethanol is amphophilic, both water and lipid soluble, which leads to rapid CNS penetration. So in movies we see that people mix water with alcohol. Anyways, so remember the points: ethyl alcohol, ethanol, C2H5OH, commonest, ROH, specific gravity 0.79, and it is amphophilic. So yes. Now, what are the sources and preparation of ethanol? Very first source is sugar. Sugar is fermented by yeast, zymase enzyme, and there is formation of alcohol plus CO2. Then fermentation stops at 15% alcohol formation, and there yeast dies. More points about fermentation: it increases the alcohol concentration, produces spirits like whiskey, rum, vodka, gin, based on boiling and condensation. So these are the points you have to remember, that the sources of alcohol are various sources, not just sugar, but fruits are also the sources of alcohol. But here sugar is mentioned, and these are the sources and preparation. So in brief manner, you have to understand that yeast is responsible, mainly zymase enzyme is responsible for the conversion, fermentation of sugar to alcohol. And why fermentation is required? Because it increases the alcohol concentration. Again, we'll be seeing types of alcohol in ethanol preparations. Absolute alcohol is the one which contains 99 to 99.5 ethanol. Rectified spirit contains 95% ethanol, and methylated or denatured spirit contains 90% ethanol plus 10% methanol, which is unfit for drinking. Methanol is poisonous, and these are the three types: absolute alcohol, rectified spirit, and methylated spirit. Coming to alcoholic beverages, approximately alcohol content is given. In beer, you have 6 to 10% of alcohol. In wine, 15 to 20. Whiskey, brandy, 45. Rum, 50%. Vodka, 60%. And alcoholic drink, alcohol plus water plus congeners. Now, what are congeners? These are the byproducts of fermentation which give taste and smell to the alcohol. So, highest concentration of ethanol is observed in vodka. Okay, remember this: beer, wine, whiskey, brandy, rum, vodka. Now, what about the absorption? 20% is absorbed from stomach, 80% is absorbed from small intestines, and rapid due to high lipid solubility. It is amphophilic. Amphophilic. Yeah, so what are the factors increasing? It is 20% from the stomach, 80% from small intestine. Now, what are the factors which increase the absorption? Number one, empty stomach, obviously. Warm drinks, Carbonated drinks, higher concentration of CO2 in it. Habitual drinking, gastrectomy, rapid gastric emptying, which will lead to the, if there is very rapid gastric emptying, then obviously alcohol would be more rapidly absorbed from small intestine. So these are the factors: empty stomach, warm drinks, carbonated drinks, habitual drinking, and gastrectomy. Now, what are the factors which decrease the absorption? Full stomach, fatty or protein rich meals, and cold water or ice. So until now we learned what is ethyl alcohol, some introductory points. We learned about the sources and preparation. We also learned about the beverages: beer, wine, whiskey, brandy, rum, vodka. Highest is in vodka, and the types: absolute alcohol, rectified spirit, and methylated spirit. Coming to distribution of alcohol, distributed according to water content of tissue. Less body water, higher blood alcohol level, obviously. So females have less body water than males. That's why females are more, what do we say, they are just more, their body reacts more to alcohol because they have less body water. Now, why females have less body water? Because they have more fat in their body, and the muscle mass majorly, generally, commonly is more in males. So more muscle mass, more is the water. That's why females have less body water. Now, one point you have to remember is the ratio between the blood and the body fluids. Very important ratio. Blood is to CSF is 1 is to 1. That means the same amount of alcohol dissolves in the, the amount of alcohol which will dissolve in blood is same as that of the CSF. If you will take blood and CSF separately, then same amount of alcohol will be absorbed in both the, let's imagine there are two containers, and one has blood and one has CSF. So both of the containers are exposed to certain or the same amount of alcohol, and both of them will be absorbing same amount of alcohol. Okay, that is why the ratio is 1 is to 1. Coming to second, blood is to vitreous fluid or vitreous humor 1 is to 1.2, which means that 1.2 times the alcohol would be absorbed in vitreous fluid. It is quite larger, quite more than blood. Then coming to blood is to vitreous fluid 1 is to 1.2, which means that 1.2 times more would be the absorption of alcohol in vitreous humor than blood. Blood is to urine 1 is to 1.3, and blood is to alveolar air 1 is to 0.00021, and which is basis of breath analyzer. Now it is updated, it is 1 is to 0.00431 something. So yeah, these are the ratios of distribution of alcohol in our body fluids. Remember, highest distribution is observed in urine. Fine, 1.3 times of that of blood. Coming to metabolism, 90 to 95% is metabolized in liver. 5 to 10% is excreted unchanged via urine, sweat, and breath, alcohol smell. Metabolic pathways, three important metabolic pathways are observed, but third pathway is minor pathway, catalase peroxidase system. It is a minor pathway. Very main pathway is alcohol dehydrogenase pathway, which is ADH pathway, and second is microsomal ethanol oxidizing system. We'll be learning about this. So the first pathway, which is our alcohol dehydrogenase pathway, ethanol is converted to acetaldehyde by alcohol dehydrogenase. Then acetaldehyde is converted to acetic acid with the help of aldehyde dehydrogenase. Acetic acid is further converted to acetyl-CoA. Acetyl-CoA is converted to it is sent in Krebs cycle, and ultimately CO2 plus water is formed. Now this pathway carries out, the site of this pathway is cytosol of liver cells, and this is one of the main pathway. And remaining ethanol, which is 5 to 10%, we learnt already that it is excreted unchanged via urine, sweat, and breath in alcohol smell. Now I told you about microsomal ethanol oxidizing system, or say pathway. So MEOS is also one of the important pathway, and the site of this pathway is nothing but your same liver cells, and but in the main pathway was main pathway means alcohol dehydrogenase pathway. The site of this pathway was cytosol, okay, cytosol of liver cells. But in microsomal ethanol oxidizing system, the site is SER, which is smooth endoplasmic reticulum of liver cells. The enzyme, just remember this, just listen this. The enzyme which is which takes part in the metabolism is cytochrome P42E1, which is CYP2E1. So this enzyme is responsible, and when this system operates in body, uh, I mean, obviously, na, if you have your main pathway, then why do you need microsomal ethanol oxidizing system? So this pathway is required when the alcohol is high in levels in body, when there is very much, when there is high amount of alcohol in body, then this pathway is activated. And ethanol is converted to acetaldehyde with the help of enzyme CYP 2E1. Yes, so this was about the microsomal ethanol oxidizing system and the site. Remember the site, it is smooth endoplasmic reticulum. Similarly, I'll talk about catalase peroxidase system very quickly. This is a minor pathway, people, and ethanol is directly converted to acetaldehyde with the help of catalase enzyme and also in the presence of H2O2, hydrogen peroxide. But the site is peroxisomes of liver cells, remember. So you have to remember the names of three pathways, you have to remember the main pathway, and you have to remember the sites of all the three. First site is, repeat with me, cytosol of liver cells. Second one is SER, smooth endoplasmic reticulum, and third one is peroxisomes of liver cells. Yes, so we now read the biochemical pathway. Now we'll be learning about mechanism of action, but before that, elimination rate is 10 to 15 ml per hour. So what is this? The alcohol is removed or eliminated from the body every hour, and the amount is 10 to 15 ml. This is a constant amount. The amount will not be changed, and it shows zero order saturation kinetics. Now, what is zero order saturation kinetics? Basically, alcohol is metabolized. It means that alcohol is metabolized at a constant rate regardless of how much alcohol is present in blood. Let's say we'll just take one example. If there are two people, A and B, A has consumed 100 milligram per dl of alcohol, okay, and B has consumed 200 ml per dl of alcohol. Now, after 1 hour, we'll be observing how much amount of blood, how much amount of alcohol is present in the blood of A and B. So let's assume that after 1 hour, we just visited both the patients, and in A patient, you'll be observing 85 to 90 ml of mg per dl of alcohol, because 10 to 15 ml is removed. And in B also, you'll observe 185 to 190 ml of alcohol present. So this is what is called as zero order kinetics. The amount of, even though the amount of alcohol is greater in B, still the elimination rate is constant, and that is why it is called as zero order kinetics. The kinetics in which the constant is not changed, the constant is not affected by the amount of substance. Okay, so this was about the elimination rate and the zero order kinetics. Remember this. Now coming to mechanism of action, it is, we all know that it is CNS depressant. Low doses cause disinhibition, behavioral stimulation. Now what is disinhibition? See, alcohol depresses brain's inhibitory centers. It depresses brain's inhibitory centers. So what happened? People start to, let's understand with one example. If you know one shy person, okay, if you know that person A is a shy person, but after intaking, I mean after after the alcohol ingestion, let's say suppose he has drank a low dose of alcohol. So in low doses, he'll start to talk, I mean, he'll start to talk very effectively. He'll just start to talk very rapidly also, and that would be against his natural behavior, right? So disinhibition means there would be more talking, becoming over friendly or laughing excessively. So these are nothing but the result of inhibition. I mean, the result of depression of brain's inhibitory centers. Obviously, if inhibitory centers of brain are depressed, then the stimulatory action would occur. That is why there would be more talking, more laughing, becoming over friendly with people. So these are the examples, and there would also be behavioral stimulation. In high doses, depression of cortical and medullary centers, and it alters the neurotransmitters and increases neuronal membrane fluidity. Now, just think that why alcohol would increase the neuronal membrane fluidity. Very easy. Just you have to just think of this point, that why they said कि alcohol increases neuronal membrane fluidity. Just think of this. It will increase the interest in the subject basically. So as the neuronal membrane, we all know that every cell membrane has got lipid in it, right? And first point which I told you people was कि alcohol is amphophilic. So as it is amphophilic, obviously it is going to absorb in the lipid molecules present on the cell membrane, right? So which is going to dramatically, or say subsequently, increase the fluidity. As the liquid would be increased as the liquid matter, or say liquidity, would be increased in the cell membrane of neurons. So why they said कि alcohol increases the neuronal membrane fluidity. I just thought कि these points actually increase the interest in subject. So this was about the mechanism of action. We also learned. So what are the things we learned in this slide? Number one, what are inebriants? We learned a new term. Inebriants are nothing but substances which produce intoxication by depressing CNS. We learned about ethyl alcohol. 0.79 is the specific gravity. It is amphophilic, or say whatever. Sources and preparation, fermentation, fine, sugar, yeast, zymase. Alcoholic beverages, 6 to 10. Remember the percent, highest concentration is in vodka, 60%. Then we learned about the types: absolute alcohol, rectified spirit, methylated spirit, yes. And absorption, 20% from stomach, 80% from SI, small intestine. We learned about the factors, we learned about the distribution, 1 is to 1.3 is in blood is to urine. We learned about the metabolism, 3 pathways, their sites, and what is the meaning of zero order kinetics. So this was all about alcohol, ethyl alcohol in this slide. Now we'll be learning about alcohol intoxication, or say acute alcohol poisoning. It is nothing but a state of behavioral, psychomotor, and cognitive impairment. The stages of intoxication, there are 3 stages: excitement stage, incoordination stage, and coma stage. So we all know alcohol poisoning is nothing but state of behavioral, psychomotor, and cognitive impairment, nothing new in this. But the stages, it has got 3 stages: excitement stage, incoordination state, and coma stage. So what is excitement stage? Whenever the blood levels contain 50 to 150 mg% of alcohol, remember the amount, number 50 to 150, fine. So it is characterized by well-being, euphoria, increased confidence and excitement, but with impaired inhibitory control. The gait would not be proper of that person. Impaired inhibitory control. In coordination stage, blood level 150 to 250, marked by muscle incoordination, impaired sense, perception, and skill movements, irritability, ataxia, slurred speech, unsteady gait, and flushed face. Everything which includes muscles, muscle incoordination, impaired sense, perception, skilled movements, irritability, ataxia, slurred speech, just one level more than excitement stage. And third one, coma stage, as the name is suggesting, coma, the person goes into coma, blood levels greater than 250 mg%. Characterized by drowsiness, coma, constricted pupils, and McEwen sign. Remember this, it is one of the repeated, this MCQ has been asked repeatedly. What is McEwen sign? Pupil dilation in response to pain. It is nothing but pupil dilation in response to pain. So what are the 3 stages? EIC. Resembling, it sounds more like LIC, but it is not LIC, it is EIC. Anyways, excitement stage, incoordination stage, and coma stage, 50 to 150, 150 to 250, and greater than 250. Okay. Now, what is the fatal dose? Blood alcohol level, if increased by 500 mg per 100 ml, then it is usually fatal. Approximate fatal dose in adults is 6 gram per kg, and in children 3 gram per kg. Talking about effects on brain lobes, frontal lobe, what effect it has on frontal lobe? Impaired judgment, abstraction, and coordination is also hampered. So impaired judgment is there, hampering of coordination is there, abstraction is also there. Now what is abstraction? Our frontal lobe is responsible for abstract thinking. So what do we mean by abstract thinking? It means that we just start to think that if certain thing happens, then what is the mechanism behind it? If a car moves, then how does that car move? That is nothing but abstract thinking. Always brain tend to ask questions, why based questions or how based questions. So that is nothing but abstract thinking. So what the alcohol effect, the alcohol affects the frontal lobe, and there is impairment of judgment, abstraction, and coordination. Temporal lobe leads to memory loss, blackouts. Parietal lobe, depersonalization. The person starts to think that he is not himself, or she is not herself, or the person starts to think that he is not present, his body is not with him, like that. And disorientation. In occipital lobe, blood vision, poor object discrimination. So these are the effects on brain lobes. We learned about the stages, fatal dose, and effects on brain lobes. Talking about cause of death in acute intoxication: respiratory failure, yes, aspiration of vomitus, hypoglycemia, cardiac arrhythmias, and head injury due to head injury during intoxication. Now, why there is respiratory failure? Because alcohol is nothing but a CNS depressant. So respiratory centers in medulla are depressed. Then hypoglycemia, because alcohol interferes with liver's ability to produce glucose. Um, the thing is, while there is metabolism of alcohol, there is release of NADH, and increase of NADH leads to the inhibition of gluconeogenesis. So the reason behind hypoglycemia is this, and which leads to the which leads to decrease in the production of glucose, leading to hypoglycemia. Talking about cardiac arrhythmias, alcohol affects the electrical activity of heart and can cause electrolyte disturbances. So why it leads to cardiac arrhythmias and head injury during intoxication. What is the management? Secure airway, risk of respiratory depression, yes. Maintain BP and circulation. IV fluids, correct hypoglycemia and electrolyte imbalance, rule out head and spinal injury, and give supportive treatment. What is the medical legal importance now? So medical legal importance is drunkenness examination, breath analyzer, blood alcohol estimation, fitness to drive and criminal responsibility. Drunkenness certificate is based on smell of alcohol, motor coordination tests, and clinical findings. So you'll understand this much better when we cover the drunkenness part. Coming to drunkenness is a state of acute alcohol intoxication causing loss of self-control, impaired judgment, and motor incoordination. Definition is quite simple. It is nothing but a state of acute alcohol intoxication, and which leads to all the features which we learned above. Clinical features: smell of alcohol from breath, euphoria leads to irritability, slurred speech, unsteady gait, ataxia, impaired judgment and memory, nystagmus, which is the rotatory movement of eyeballs, and in severe cases leads to stupor or coma. How you are going to examine it? Based on smell of alcohol, motor coordination gaits, or tests, and mental status examination. Breath analyzer or blood alcohol estimation is also used in examination. Now we'll again read the medical legal importance of alcohol intoxication. You'll be undergoing drunkenness examination. Breath analyzer is used or blood alcohol estimation is done. Fitness to drive is checked and criminal responsibility is also checked. And drunkenness certificate is based on three things: smell of alcohol, motor coordination tests, and clinical findings. Talking about the medical legal importance, it is relevant. Drunkenness certificate, or say drunkenness point, is relevant in road traffic accidents, crimes of violence, and consent and criminal responsibility. Voluntary drunkenness is not a defense. Now, this line is very important. This line means that anyone who has voluntarily taken alcohol and has undergone drunkenness and he commits a crime after that, so that crime is liable crime. I mean, he or she would be punished for voluntary drunkenness, and he cannot say, or she cannot say, that I was drunk so I should not be punished. No, you were voluntarily drunk. You voluntarily drank the alcohol. That's why he or she will be considered as criminal, or say liable person for the crime which he or she committed. So this was about the voluntary drunkenness is not a defense in court. And driving offense if blood alcohol is found to be greater than 30 mg per 100 ml in India. Okay, greater than 30 mg per 100 ml. This was all about alcohol intoxication or acute alcohol poisoning. Remember the stages: EIC, excitement, incoordination, coma; fatal dose, effects on brain lobes; then drunkenness, clinical features, examination, cause of death, management. Management is important: secure airway, maintain BP and circulation. Medical legal importance, and medical legal importance again. So yes, this is all about acute alcohol poisoning. Now last point is remaining, which is chronic alcoholism. Everything is related to alcohol today, and here comes the chronic alcoholism. Alcoholism is a chronic, this is last slide. It is a chronic compulsive dependence on alcohol with tolerance and withdrawal symptoms. So first and foremost thing, it is chronic. Number two, compulsive dependence is there with tolerance and withdrawal symptoms. You'll also be finding withdrawal symptoms. What are the features? Strong craving for alcohol, loss of control over drinking, tolerance, which means needs larger doses, and withdrawal symptoms on abstinence. So these are the points these are the features of chronic alcoholism. The person will crave for alcohol, and he'll also need larger doses subsequently. 4 complications of 4 systems: CNS, liver and GIT, genitourinary, and CVS. In CNS, you'll be observing peripheral neuropathy, cerebellar degeneration, Wernicke-Korsakoff syndrome, and delirium tremens. In liver and GIT, fatty liver, cirrhosis, gastritis, pancreatitis. In genitourinary system, impotence, testicular atrophy, decreased sperm count, amenorrhea, loss of bleeding, infertility, spontaneous abortion. In CVS, alcohol, cardiomyopathy, and hypertension. So these, just remember, just go through once. These complications are important because these are directly asked in MCQs. CNS, liver and GIT, genitourinary system, and CVS. Moving ahead, what is the meaning of withdrawal syndrome? 6 to 12 hours, tremors start, earliest sign. 12 to 24, these are nothing but the symptoms which are observed whenever the alcohol is withdrawn suddenly from the body of chronic alcoholic. After 6 to 12 hours, tremors would be seen, earliest sign. 12 to 24 hours, alcoholic hallucinosis. 24 to 48 hours, convulsions, which are also called as rum fits. 2 to 5 days, delirium tremens, alcoholic ketoacidosis, and Wernicke's and Korsakoff syndrome. After 2 to 5 days. So what is delirium tremens? Delirium tremens typically appears 3 to 5 days after stopping alcohol consumption and has a sudden onset, characterized by confusion, disorientation, hallucination, agitation, restlessness, tremor, insomnia, and autonomic disturbances like sweating, fever, and rapid heartbeat. Delirium tremens are nothing but symptoms which are characterized by confusion, disorientation, and blah blah. What is the legal responsibility? Individuals experiencing delirium tremens are not held responsible for their actions due to impaired mental state. So according to law, these peoples are not held liable for whatever they do, because that is considered, delirium tremens is considered as acute insanity. Fine. Then remember that it occurs after 2 to 5 days. Nothing, confusion, disorientation, hallucinations, agitation, restlessness. What is Wernicke's and Korsakoff syndrome? It is alcohol-induced persisting amnestic disorder due to thiamine deficiency. What is thiamine? It is vitamin B1. Okay, now it is alcohol-induced persisting amnestic disorder. Amnestic means severe loss of memories, okay, or inability to learn new things, or both. Either there is loss of memories or the person is unable to learn new information. And now what is Korsakoff syndrome symptoms? Profound antegrade amnesia, new memory is lost. Milder retrograde, past memory mildly is lost. An impairment in visual, spatial, abstract, and conceptual reasoning. So visual, spatial reasoning, abstract reasoning, and conceptual reasoning is also lost in, and these are the symptoms of Korsakoff syndrome. Now what are the symptoms of encephalopathy or Wernicke's syndrome? Drowsiness, disorientation, amnesia, loss of memories, ataxia, no coordination between movement, peripheral neuropathy, horizontal nystagmus, and diplopia due to ophthalmoplegia. So these are nothing but the symptoms in Korsakoff syndrome and Wernicke's syndrome, and these are observed under withdrawal syndrome after 2 to 5 days. Note, Saturday night paralysis or Saturday night palsy occurs when an intoxicated person sleeps with their arm over a chair, compressing the brachial plexus and causing muscle paralysis. We learned it in anatomy. Alcohol palimpsest, which is called as alcoholic blackouts. Patchy amnesia, which is not associated with unconsciousness. Now, how you are going to manage? Adequate nutrition, rest, vitamin B supplementation, benzodiazepines for withdrawal symptoms, and aversion therapy, disulfiram, which inhibits the alcohol metabolism, causing unpleasant symptoms and deterring consumption. Counseling, psychotherapy, and rehabilitation. So disulfiram inhibits the alcohol metabolism, because of which unpleasant symptoms are occurred, and which leads to the decrease in consumption of alcohol because of those unpleasant symptoms. Now, what are the sections related to alcohols? There are basically 4 sections: 22 BNS, 23, 24, and 355. 22 BNS says, if a person commits a crime under delirium tremens. Now, what is delirium tremens? Remember delirium tremens? It is nothing but confusion, disorientation, hallucinations, agitation occurs after 3 to 5 days. So what law says, if a person commits a crime under delirium tremens, he is not liable for punishment, as it is a state of acute insanity. Fine. 23 BNS says, crime committed under involuntary drunkenness is not liable for punishment. Now, here this line, you should remember the line which we learned earlier, that voluntary drunkenness is not a defense in court of law. Let's see 24 BNS. Crime committed when under voluntary drunkenness is liable to be punished. 355 BNS, punishment for causing public misconduct under alcohol influence. 24 hours of jail, imprisonment, 1,000 rupees fine, and community service has to be given. So What are the sections? 23, 24, 22, 355. Now, what is Motor Vehicle Act MVA 1985? Legal limit for blood alcohol levels for drivers in India is 30 milligram percent. Beyond 30, fine is levied and with suspension of license. If that is first offense, 10,000 fine. If second offense, 15,000 fine plus suspension of license. Okay, so this was about the Motor Vehicle Act 1985. Remember the year 1985. We learnt about chronic alcoholism, we learnt about acute alcohol poisoning, stages of intoxication, medical legal importance of drunkenness, what is drunkenness, what is the driving offense. We also learnt about the management, causes of death. We learnt about the inebriance, introduction of ethyl alcohol, and very important thing, metabolic pathways of alcohol and their sites. So this was all about your acute and chronic ethyl alcohol poisoning. Now take out your notebook, or say don't take out, just solve with me here only. Yes, so we'll be solving MCQs now. Oh wait, starting with our very first MCQ. Which of the following is the chemical name of ethyl alcohol? Methanol, ethanol, isopropanol, propanol. I want you people to stop this video and solve these MCQs on your own. Then at last you can check your answers. Correct answer option B, ethanol. Ethyl alcohol is a hydroxy derivative of, very easy question, ROH. No need to read options also, aliphatic hydrocarbon. The specific gravity of ethanol is, now this is a factual question, 0.5, 0.79, 1, 1.2. Option B, 0.79. Ethanol is, option C is the right answer, it is amphophilic. Major route of metabolism of ethanol in the body is aldehyde dehydrogenase pathway, ADH pathway, catalase pathway, direct excretion. Aldehyde dehydrogenase pathway is no such pathway. Read the options very carefully. It is alcohol dehydrogenase pathway. Option B would be the right answer. Which of the following is the first metabolite of ethanol? Acetic acid, no. Acetaldehyde, yes. Acetyl CoA or CO2. Option B is the right answer. I'm solving it very quickly because the video limit is exceeded already. So I want you people to stop the screen, to stop this video and solve these MCQs on your own. Just check your answers at the last. Fine. It will save your time. Question 7. Blood alcohol level of 150 to 250 mg% is associated with excitement stage, coma stage, incoordination stage, or delirium tremens. Answer is incoordination state. Mc-Even sign is seen in excitement stage, no. Coma stage, yes. It is pupil dilation due to in response to pain. Is it pupil dilation or pupil constriction? Let me check once. It is pupil dilation in response to pain, yes. Blood alcohol level greater than 500 mg per 100 ml is usually non-fatal, potentially fatal, always fatal, harmless. This is important question. Now many of you would be thinking option C is the right, but option B is the right answer. It is potentially fatal. Now why it is not always fatal? Because in chronic alcoholic people, their body already gets adopted to the levels of alcohol. So why for them 500 mg is not also 500 mg also is not enough. Fine, but for other ones, these this range is very high for normal people, but for chronic alcoholic persons, this is not a this range is also not fatal range for them. So the answer would be potentially fatal. The most common cause of death in acute alcohol intoxication is hypoglycemia, respiratory failure, cardiac arrhythmia, hepatic failure. Answer is respiratory failure. Which of the following is not a feature of incoordination stage? Unsteady gait, slurred speech, increased confidence, muscle incoordination. Not a feature. Increased confidence, because it is a feature of excitement stage. In coma stage of acute alcohol poisoning, which sign is characteristic? Drowsiness and constricted pupils, hallucinations. I'm sorry, I'm not reading it properly. Euphoria, drowsiness and constricted pupils, tremors, or hallucinations. In coma stage. Answer would be option B. Blood alcohol level is estimated from all exam. This is incomplete MCQ. We'll just skip this because A, B, C. No, I think option D would be the answer, but we don't know option D what it is. Blood alcohol level is estimated from all. Yes, blood, CSF, urine, everything. From everything it is estimated, except I think. Okay, we'll just skip this MCQ. 14th elimination rate of ethanol is approximately. 1 to 2, 5 to 10, 10 to 15, 20 to 25. It is 10 to 15. Coming to question 15th, drunkenness is best defined as chronic alcohol dependence, acute alcohol intoxication, state of acute intoxication causing loss of self control, impaired judgment, and motor incoordination, withdrawal syndrome. Drunkenness. Correct answer is option C. Which of the following is not a clinical feature of drunkenness? Not a clinical feature. Smell of alcohol, slurred speech, ataxia, and bradycardia. Obviously, bradycardia is not a feature. 17th. In severe cases of drunkenness, the person may go into stupor, coma, euphoria, or delirium. Severe cases, stage 3, coma. Option B is the right answer. 18th. Breath analyzer detects alcohol by measuring what? Very easy question. Blood? No. Urine? No. CSF? No. Option B is the right answer. Drunkenness certificate is medical legally based on what? Smell of alcohol, motor coordination tests, clinical findings, all of the above. We repeated this several times. Answer is option D, all of the above. Which of the following is true about drunkenness? It is a defense in criminal cases. It is not a defense. Yes, it makes a person irrefutably liable. It is equivalent to insanity. It is not a defense. Voluntary drunkenness is not a defense. Option B is right answer, unless and until proved. 21. Alcoholism is best defined as occasional drinking, chronic compulsive dependence on alcohol with tolerance and withdrawal symptoms, social drinking, binge drinking. Option B. A hallmark feature of alcoholism is loss of control over drinking, complete abstinence, no tolerance, immediate withdrawal symptoms. Not immediate, 6 to 12 hours. The earliest sign is seen in 6 to 12 hours. And now, what is the earliest sign? Think, tell me. Yes, tremors are the earliest sign. So the answer is option A. Loss of control over drinking is the hallmark feature. Which of the following is a complication of chronic alcoholism affecting CNS? Peripheral neuropathy, cerebral degeneration, pseudobulbar palsy, all of the above. Option D, all of the above. Wernicke's encephalopathy is due to deficiency of which vitamin? B6, B12, C, B1. Option B, B1. Korsakoff's syndrome is characterized by confusion and tremors, persistent amnesia, visual hallucinations, muscle rigidity. What are the symptoms of Korsakoff syndrome? Persistent amnesia is one of the symptoms. Option B is the right answer. Alcoholic cardiomyopathy is a complication of, obviously. Since it is cardiomyopathy, it would be complication of CVS. Option B, 26B. Now, what are the important points? Fatal dose, remember, greater than 500 mg per 100 ml. Metabolism, 90 to 95% in liver via ADH, alcohol dehydrogenase pathway. Elimination rate, 10 to 15 ml per hour. Zero order kinetics. Constant elimination rate. Delirium tremens, 3 to 5 days after stopping alcohol. Wernicke's syndrome symptoms: confusion, ataxia, ophthalmoplegia, thiamine deficiency. Korsakoff's persistent amnesia and drunkenness would not be used as defense in court of law. So these were the MCQs, and we have successfully completed the topic, and I want you people to revise the topic. If you want to take screenshot, you can take by pausing the video and increasing the quality. Yes. So yeah, this was about our acute and chronic ethyl alcohol poisoning lecture. I hope you people liked it. I don't know you people liked it or not, but let me know what changes I should make in upcoming videos, and enjoy learning. Please revise the topic. It is simple topic yet very important topic from university point of view as well as PG point of view, and keep solving MCQs. Revise it very thoroughly, and yes, don't forget to subscribe and hit that like button also. It kind of give me strength to make another videos for you people. So until then, keep learning, keep growing. See you in the next video. Bye.